Hello, and thank you for joining me for my presentation of cardiovascular disease among middle-aged sedentary African American women. My name is Lindsay Leek, and let's get started. Some background information for you and fast facts regarding cardiovascular disease and the prevalence. It is currently the leading cause of death for Americans, and this data is pulled as recently as 2021. It is highest amongst African American men and women, and African American women are the most at risk of actually developing cardiovascular disease. African American women in their mid-40s or are older were found to be less likely to engage in physical activity than their Hispanic and Caucasian counterparts. I did want to mention that statistically, the CDC reported as of this year, 2022, is that 1 in 2 Americans do not engage in enough aerobic activity. Physical activity is a major risk factor of developing cardiovascular disease, which is why engaging in physical activity is so important in prevention. I'd like for you to look at this chart and review the data. If you will see, we are looking at CDC, the information from the CDC's website regarding non-Hispanic Black females and their cause of death. As you can see, the prevalence of African American women dying from heart disease increases as they get older, which is very disturbing, and it's why it is so important to understand the health behaviors that attribute to the lack of physical activity. And as I mentioned in the introduction, we will be focusing on the sedentary behavior. That brings me to the risk and protective factors for African American women developing cardiovascular disease due to the lack of physical activity. The risk factors are sedentary behavior, a diet high in saturated fats, low in fruits and vegetables, health conditions that are associated with cardiovascular disease, such as high blood pressure, high cholesterol, diabetes, and obesity, excessive consumption of alcohol, and smoking. The protective factors are leisure time, reduced stress levels, diets high in fruits and vegetables, and social support from family and friends. When we're thinking about the risk and protective factors for our target population for this presentation, we are going to be looking at the social ecological model. Here on your slide, you can see the social ecological model in regard to physical activity is broken down into interpersonal, community, and environmental levels. I'd like to discuss the interpersonal, the individual characteristics that influence physical activity, which includes the attitudes, beliefs, knowledge, and personality traits. The interpersonal are primary social groups, the cultural influences on physical activity for African American women, which includes their family, friends, peers, and cultural norms. The community and environmental levels include social and environmental characteristics that influence the physical activity, social institutions, physical neighborhoods, community structures, and characteristics as weather. Based on the social ecological model, when we're looking at physical activity for African American women 40 years or older, the barriers broken down into interpersonal, and community and environmental. I'd like to point out a couple for each category as something for you to keep in mind while we're going through this presentation. Interpersonal barriers such as the knowledge and motivation, health concerns, physical appearance, specifically hair care and maintenance, and fatigue. Interpersonal barriers such as family and caregiving responsibilities, work obligations, the lack of social support, and lack of an exercise partner. Community and environmental barriers lack of facilities and sidewalks, the neighborhood safety, a lack of African American physically fit role models. All of these barriers play a role in the fact that African American women are less likely to engage in physical activity, thus putting them at a higher risk of developing cardiovascular disease. After we viewed the social ecological model with regards to physical activity for this target group, I'd like to mention that over the last 2 decades, the prevalence of cardiovascular disease in African Americans has not declined. It has actually increased for African American women. So the need for health behavior theory-based interventions has been identified, and we will look at 4 of these theories and some of the interventions that have previously been applied and their results. Theory of planned behavior. Interviews of participants were conducted to assess how the role of perceived behavioral control would play into physical activity being increased in our population. The results concluded that perceived behavior of control could be beneficial for our group and build on exercising that belief and control over performing and engaging in physical activity. The results of the interviews also concluded that there is a limited amount of research within African American women 40 years or older in increasing their level of physical activity. The social cognitive theory, there were focus groups conducted to determine intervention design and whether or not social cognitive theory could prove to be successful. This was for physically inactive or obese African American women between the ages of 24 and 49 years old. The constructs assessed were behavioral capability, outcome expectations, self-efficacy, self-regulation, and social support. The results of the results of these focus groups really highlighted the fact that social support and outcome expectations proved to be the most successful when eliciting a health behavior change within our target population, and that participants of these focus groups noted that having an accountability partner could prove to be they could be successful incorporating physical activity into their lives long term. The trans-theoretical model, this study was conducted to determine the success of interventions focusing on the stages of change. The target group for this study were physically inactive or obese African American women between the ages of 45 and 70. The constructs used within the study were self-determination, self-efficacy, and self-regulation. The results concluded that the trans-theoretical model of change is more efficient than fear-based models, especially when you're focusing on the stage transition. I would also like to note that the self-determination was more decisive in the women that were in the preparation, action, and maintenance stages of this study. The fourth and final theory that we are going to look at is a combination of the social cognitive theory and the trans-theoretical model of change. This study consisted of questionnaires being completed to determine levels of self-efficacy and measuring self-motivation and social support for program participants to engage in physical activity. The target population for this were actually hypertensive African American women between the ages of 40 and 65. The constructs, again, the stages of change, self-efficacy, and social support were utilized in these questionnaires. Most of the sample of these questionnaires proved to be in the contemplation stage, and it was self-reported that the participants did not have a significant social support system. It was concluded that interventions should focus on establishing social support systems and creating a greater level of self-efficacy through behavioral strategies. My proposed intervention would be similar to the last one that we looked at. It would be a combination of the social cognitive theory and the trans-theoretical model of change. I believe that utilizing the constructs that were identified through my research and the interventions that I have reviewed, the constructs of social cognitive theory, including self-efficacy, outcome expectations, and social support, could really prove to be beneficial in creating a lasting behavioral change. I believe with the trans-theoretical model, utilizing that as a measurement, utilizing it as a means of measurement for readiness to change, and really focusing on the stage transitions from contemplation to preparation and from preparation to action, and also building upon self-determination and self-motivation. I believe that the appropriate intervention would be culturally relevant, appropriate, supportive, and inclusive. I think that collaborating and partnering with African American or Black women that are in the target population's age, 40 years or older, would increase the chances of the goal of making this intervention culturally relevant. It would be a multi-level approach with focus groups, one-on-one counseling, telephone and or text buddy system, and would include home-based activities for physical activity, due to the fact that some of the environmental and community barriers do not allow for this target population to exercise and increase their physical activity on a daily basis. Some potential ethical concerns, again, mentioning the fact that it is absolutely necessary for the intervention to be culturally relevant and appropriate. The intervention creation and the implementation must include African American and or Black women. As I identify as a Caucasian woman, I believe that it would be unethical and culturally irresponsible to create or implement this level of an intervention without partnering and collaborating with colleagues that identify themselves as women that are African American or Black. I believe the integrity of the intervention would be compromised. The intervention also needs to be visually appealing. It must include diverse, colorful images and cultural depictions of African American women. It must be carefully tailored. If it is not carefully tailored, that could certainly be an ethical concern. Being able to create this intervention and implement it to the target population, being able to incorporate it into their lifestyle without devaluing their hair care maintenance and personal appearance, and also being able to tailor this intervention into the life milestones, whether that be for this age group, 40 years or older. It could be menopause, it could be women that are career focused and family centered, or one or the other. So it's very important to tailor these interventions accordingly, because it certainly could be an ethical concern. Please take a moment to review my references that were utilized throughout the creation of this presentation. Thank you very much for allowing me to share my presentation with you. Have a lovely day.